Hi, my name is Deep and I have motor neuron disease. There are many people involved in and continue to be part of my care. My wife and GP have been my primary caregivers, but as my health worsens, I am seeing more people, including specialists for my condition, physiotherapists, specialist nurses, palliative care consultants, hospice staff, a range of therapists, social workers and a care agency. Then there is my pharmacist who provides vital support, and as I have a range of health issues, I have additional appointments to go to every few months. Organizations such as MNDA and my local hospice have also been integral to improving my quality of life and independence. When I was first diagnosed, I had to learn a whole new language relevant to my care and didn't know how to access support. It was a challenge to know who to ring, and often the people I contacted didn't know how to help or where to send me. Sometimes they didn't ring back and I would feel helpless. Eventually, I made contact with a social worker who understood the various systems and could explain the different roles and right people to contact. He listened to what I needed, focused on what could be achieved, and made sure I was kept up to date with relevant information. It's hard enough living with the condition, but imagine how hard it is when the services don't communicate and fail. It's important to remember I am a person, not a disease. What I need is people who call back, translations of medical and health language into plain English, help with understanding and pulling all the systems together, people to listen to me and remember that I know what I need and what helps, compassion, respect for my capacity to make decisions regarding my care. My care information shared appropriately with everyone who needs access to it. Having the support I need allows me to worry less about my health and make the most of every day, which is very important to me.
Hi, my name is Kathy, and I was recently the primary carer for my sister. When my sister was first diagnosed, our whole world turned upside down. We were dealing with so much emotionally, and there was so much information we had to find, it was hard to know where to start. I looked things up on the internet. I contacted many organisations, just trying to learn as much as I could. At times it was incredibly stressful and depressing, and I felt quite overwhelmed. The care that my sister needed was completely outside my experience, but I wanted to do the best for her and also for her son as well. And it was a huge learning process for all of us. I felt that it was my job to make sure all the practical things were taken care of so that she could maintain her quality of life. There were so many things to sort out. Getting benefits because she couldn't work, trying to fit everything in around my work, organising the various support services who could really help us. Like getting a blue badge because she couldn't walk far, learning about things like stair lifts and hoists. But in the end, with the help of a really good social worker, we actually started making sense of it all. And one of the key things that I had to learn was that my responsibility was also to look after myself. What I needed from other people was people who returned my calls and responded to our needs, a support that empowered us and respected our boundaries, help with translating medical and health language into plain English, help with understanding and pulling all the systems together, support that let me also look after me, compassion, and respect for my role as my sister's primary carer in the decision-making process. With the right guidance, I developed the tools that I needed to be her primary carer and also to help my nephew through such a hard process. In the end, the support we received made it possible to enjoy the time that we still had together as a family.
Hi, my name is David and I'm a hospice worker. My role in end-of-life care is providing care for people who have life-limiting conditions and for people who are dying. What I do is provide care that's similar to hospitals, but I'm able to provide much more personalised and holistic care. In other words, I look after the whole person. I talk to people about their wishes for their end of life. I make sure their pain and other symptoms are controlled and offer them complementary therapies like massage and relaxation, and provide activities for the person to enjoy. I also support people at home, making sure that equipment and medication is available. Many different professionals work with or in hospices, such as doctors, palliative care consultants, GPs, nurses, social workers, volunteers, counsellors and many, many more. I offer support to family members too, including bereavement support and ways of remembering people. What I need is a supportive team, good communication between all hospice staff, for it to be okay to admit you're not sure about something, regular team meetings where people can say what they need help with or update other staff about what's happening with a person receiving end-of-life care. Hospices offer a restful, supportive and safe place for people and their families, and also provide support through the whole community.
Hi, my name is Sarah and I'm a domiciliary or home care worker. My role in end-of-life care is to provide practical support to people in their homes. Our work isn't only about end-of-life care, but we come into contact with it quite often because many of the people we help are elderly or confined to their homes because of their health. What I do is helping people to wash, get dressed, move from bed into a chair, sometimes using a hoist. I get to know their likes, dislikes, what's important to them. Often this means working alongside the district nurses, for example, sharing information about the condition of someone's skin. I support families and others who care for the person by taking the pressure off and giving them a break. Sometimes I help with shopping and going out and with practical tasks like cooking or cleaning. What I need is to understand what the person and their family want and needs. I need to build up a picture of the whole person. I need to be listened to by others who provide care when I tell them about the client because I get to know them well. I need support and to know who to go to if I'm not sure how to do something. It brings me great satisfaction to be able to do the big and little day-to-day things that can help bring comfort and security to a person and their family during this time in their life.
Hi, my name is David Whale and I'm a commissioner. My role in end-of-life care is to make sure that local services meet people's needs. What I do is look at information about local community and its needs and ensure that organisations are in place to provide that care. Some commissioners have broad roles and focus, for example, long-term conditions or just elderly care. I have a focused role in end-of-life care. I make sure that services are providing the right standard of care and listen to the staff who are working in that area to make sure that they have the skills and the support that they need to carry out their role. I listen to the people who are using the services and make sure that we're meeting their needs. What I need: up-to-date, accessible information about the latest guidelines, strategies and policies, including what this means in practice, a good working network, willing to communicate across all organisations. For people to put the person at the centre and to think about what we can bring to the person's end-of-life care. Sharing of information so that families don't have to keep repeating the same information. People being open to see how that they can improve the care that they give. While my aim is to make sure that taxpayers' money is spent wisely, it's equally important that I ensure the services we're delivering meet the needs of your community.
Hi, my name is Vanessa and I'm a palliative care specialist. My role in end-of-life care is to provide specialist support to people at the end of life and to those who are caring for them, whether they are family members or paid professionals. What I do is work with hospitals, consultants, general practices, hospices and the community to ensure that people get the right care wherever they are. I help people to have conversations about their end-of-life wishes. I'm responsible for making sure the person has a choice in place of care, which necessary equipment is provided and that medication is available when it's needed. I make sure staff know what to expect and are confident and supported in their role. I offer support to general staff that may not work with people at the end of their life very often, such as hospital nurses and healthcare assistants. I work with GPs, nurses, pharmacists, social workers, and anyone else who's involved with the person receiving end-of-life care to make sure they live well until they die and that family members are supported afterwards. What I need is for everyone to know the person's wishes and feel confident about playing their part. Good relationships with colleagues and support from senior management. People not being afraid to admit when they don't know something and ask for help. To be flexible and respond to unexpected situations that arise. Communication with the rest of the staff and social care or social services. Knowing that my work helps people experience the best possible end-of-life care and that those around them are supported makes me very proud.
Hi, my name is Jo and I'm an adult care social worker. My role in end-of-life care is to make sure that people live as well as possible in the time they have left. I work with many other people, such as healthcare staff, general practitioners and healthcare teams, but I don't provide medical care myself. Although I don't specialise in end-of-life care, it's a part of life and it can be an important part of my work. What I do varies a lot. My job is to work with people to find out what their needs are and what matters to them, and then help them to organise their care and support. This might include delivery of meals, home care, or a befriending service. Sometimes I work with district nurses to arrange equipment, such as hospital beds or commodes. Sometimes I work with palliative care specialists, such as the palliative care social work team. It really depends on the situation. Carers can need support as well, and I can organise a carer's assessment to look at their needs. When someone is discharged from hospital, I can make sure that they have the support when they get home. What I need is a close working relationship with the people I'm supporting in the community, with colleagues in social and health services, and with others involved in providing support, such as housing providers, for the family to be completely informed about every aspect of care and to be reassured and supported, for the person's end-of-life care wishes to be known and taken into account, for everyone involved to be working together to give the best possible care. Communication, it's a really important part of my role, really listening to what people say about what matters to them. My job is to look after the whole person, to support people during loss and bereavement, to help them come to terms with their situation, and to help with organising practical support so they can focus on making the most of their lives.
My name is Sally and I'm a GP. My role in end-of-life care is to support patients and families who are being cared for in the community, for example, at home or in a care home. We see patients of all ages with anything from minor health issues to life-limiting conditions. What I do is work as part of a team with healthcare assistants, practice managers, receptionists, district nurses, social services and others. I help identify when a person is nearing the end of their life and talk to them about their wishes. I assess medical needs. For example, if someone is breathless, I can prescribe medication or oxygen to help. I work with the patient, family and district nurses, planning ahead to avoid unnecessary delays in provision of medication, especially out of hours. I visit people at home and make sure that out of hours services know people's end-of-life care wishes, particularly for resuscitation. I make sure families know what to do if someone deteriorates so that they're not rushed to hospital unnecessarily. What I need is good communication with families and district nurses about medication and how the person is responding. For everyone involved in the person's care to know their wishes and what to do if they deteriorate or die. Use of electronic palliative care coordination systems that allow the necessary people to have access to the right information at the right time. And clarity about what level of support is being provided. This is also known as the care package. I try to make sure that the whole person is cared for, including their beliefs and cultural wishes.
Hi, my name is Pauline and I'm a district nurse. My role in the end-of-life care is to support people in their homes, including care homes. We often work with people over a period of time and get to know them quite well. What I do is assess people's needs and wishes, including where they'd ideally like to die, and make sure everything is in place to support their wishes. On the medical side of things, I do things like changing dressings, catheter care, and making sure people's symptoms are controlled. Where people need support with other things like getting out of bed or getting washed and dressed, I then work with social services to arrange for care, support and equipment to be put in place. I provide practical and emotional support to families and carers to make sure they feel confident and supported. I meet with other professionals and organisations that are involved in the person's care to make sure we're all working together and consider what support might be needed in the future. I do try hard to avoid unnecessary hospital admissions, especially when the person would like to die in their own home. What I need is to know who else is involved in the person's care and talk to them regularly, to assess people's needs early so that we can then plan ahead and try to avoid crises, a supportive attitude from everyone involved, people taking responsibility for their aspect of care, and to know that other services will support the patient when we're not around, and everyone knowing the person's wishes. When I'm able to provide quality care to people in their own homes, then they can feel more comfortable and confident in facing the future.